Check patient's recommended diet prior to providing food or liquids to ensure safe consistencies. Patient should always be in upright position when consuming foods, liquids, or being administered medication. Up in a wheelchair or chair is best posture during meals. However, if the patient must be in bed, make sure he or she is as close to 90 degrees as possible. This patient is not sitting at 90 degrees and needs assistance.
Go ahead.
Lower the bed and assist patient scooting up so that hips are bent when the bed is raised back up. Never attempt to feed a patient who is not alert or responsive enough to follow verbal or tactile cues.
John, it's time for breakfast. John?
Make sure patient has clean dentures, glasses, and hearing aids in place prior to meal. Encourage patient to refrain from talking or laughing with food or liquids in their mouth.
So how are you doing today?
John, go ahead and swallow that. I'm doing fine. How are you?
Good.
Cue patient to control portion size to 1 level teaspoon bites.
Let's try something a little smaller, John. That's just too big of a bite. That's better.
Feed patient or cue when needed to maintain a slow rate of intake. Allow time for extra swallows if necessary.
How's that? Is it going down okay?
Mm-hmm.
All right, let's try another bite.
Alternate foods and liquids throughout the meal. A good rule of thumb is 2 bites of food followed by a sip of liquid.
Oh, before you take that bite, remember 2 bites and then a drink. Good job.
Throughout the meal, check patient's mouth for pocketing of food.
All right, open your mouth. Let's take a peek. Oh yeah, I see lots of banana there.
If pocketing occurs, there are 3 techniques to try. Number 1, provide external pressure to the cheek and push the bolus out of the cheek. Number 2, cue the patient to do a lingual sweep to clear the food from his cheek.
John, I want you to try to use your tongue and clear the food from your cheek. Good job.
Number 3. Cue the patient to use a liquid wash to remove the food.
Take a drink and see if you can clear it. All right, let me take a peek. Looks good.
If a patient starts to cough during eating, tell the patient to stop eating until coughing ceases.
Let's not take another bite. Keep coughing, John. Is that better? Okay.
Never pat the patient on the back to assist with a cough. Instead, encourage patient to lean forward slightly and continue to cough.
Okay, I want you to lean forward, John. Keep coughing. Feel better? Okay.
A chin tuck is often needed to help protect the patient's airway during a swallow. If patient is recommended to use this strategy, please cue them as needed.
John, remember, you want to sip, tuck, and then swallow.
Okay.
Good job.
If you observe a patient holding food or liquid in their mouth for a long period of time, encourage the patient to use the 3-second swallow technique.
I'm going to count to 3 and then I want you to swallow. 1, 2, 3, swallow. Very good.
If you are unsure if the patient has swallowed, lightly place your fingers over the patient's neck around the area of their Adam's apple and feel for movement of the swallow. Oral care is recommended frequently to reduce the risk of developing pneumonia. One of the worst things patients can aspirate is secretions in their mouth, which contain bacteria. Here is an example of appropriate oral care.
All right, go ahead and brush your teeth. Okay, and make sure you get way back there. Good job, and then when you're ready, take a sip of the mouthwash and rinse out your mouth. Swish it back and forth. Okay, and when you're ready, you can spit it out.
Here are some feeding techniques. Sometimes the patient has difficulty initiating feeding themselves. 2 beneficial strategies include placing the plate in front of the patient to bring attention to it, and/or placing food on a utensil and the utensil in their hand. If the patient has trouble holding food or liquids in their mouth, here is a technique to assist with that.
Try another bite and I'll help you with this one. Remember to try and keep those lips tight. Keep it tight. Good job.
If patient is reluctant to open their mouth during the meal, try brushing or tapping the spoon on their lower lip gently to encourage an open mouth posture.